Welcome to Learning Anatomy with Dr. Bakare. In this lecture, we'll be looking at the differences between the compact type of bone and the spongy type of bone. We'll be putting these differences in a tabular form so that in case we are asked during examination, it will be easy for us to highlight. The compact bone can also be referred to as the cortical bone, while the spongy bone can also be referred to as the cancellous bone. Compact bone is seen in the outer region of bone, while spongy bone is seen in the inner region of bone. If you look at this lower image, this is where we have the compact bone carried in the outer margin of this bone tissue. And if you go to the inner margin, we have the spongy type of bone. So we see that the spongy bone is usually sandwiched between two layers of compact bone. Structurally, the compact bone is made up of osteons. Osteons is a concentric arrangement of bone tissue. So you see this circular arrangement of bone tissue that is referred to as lamella. This lamina, you see that they present a circular pattern of arrangement. And at this central point here that is carried in yellow is where we have a space or a canal that is referred to as the Avesian canal. This Avesian canal is what creates the accommodation site for the blood vessels. So you have blood vessels located at this central space, and you see a concentric arrangement of bone tissue around this Avesian canal. And this is what is the structural configuration of the compact bone. The spongy bone has a different configuration. If you look at this image by the side here, this is where we have the structural configuration of the spongy bone. Spongy bone is made up of bone tissue that are irregularly arranged. These bone tissue are referred to as trabeculi. These trabeculi are arranged in an irregular pattern and are seen with spaces. And this is what is projected here in this image. So this is the structural configuration of the spongy bone, and this other side here is the structural configuration of the compact bone. This structural configuration presented by the compact and the spongy bone is responsible for their gross presentation. If you go further in highlighting the differences between these two bones, you see that the compact bone has its tissue densely packed. If you go back to this image by the side, we say that the compact bone is structurally made up of concentric arrangement of bone tissue seen to be densely packed. So you see a tightly packed bone tissue presented in this configuration. While in the spongy or the cancellous bone, the bone tissues here are seen to be loosely packed. And this is why you see the space is located within the bone tissue. So the compact bone is tightly packed, while the spongy bone is loosely packed. And this is what leads to also the hardness that is presented by the compact bone. The compact bone is seen to be hard because the bone tissues are tightly packed, because there is no space between this bone tissue as presented here in this image. The spongy bone is seen to be soft because the bone tissues are loosely packed. And this is why it is also easy to bite through the spongy bone, because it presents a number of spaces. So the teeth can bite through this type of bone, while the compact bone, the teeth cannot bite through this type of bone because there is no space within the bone tissue. So it is seen to be hard. Also, in terms of their weight, the compact bone is seen to be heavier. And it is heavier because they are hard, and they are hard because the bone tissues here are tightly packed. So you can see that one feature is causing another presentation, and this can be linked as we have highlighted. So because it is hard and it is densely packed, it appears to be heavier. While the spongy bone is lighter, it is not as heavier as what the compact bone presents. And this is because the bone tissue here are loosely packed and they are also soft. It is also important for us to add that the compact bone are usually seen in the diaphysis. If you take a structural orientation of a long bone, you see that the long bone is made up of the diaphysis, which is also referred to as the shaft, and this is the handle of the bone. This is what is harrowed here in purple. This region of the bone is structurally made up of a compact type of bone, and it is leaving a central space that is referred to as the medullary cavity. This medullary cavity is what creates accommodation site for the bone marrow. When we go to the terminal edges, at this distal region and also at this proximal region, you have the epiphysis. This epiphysis is structurally made up of a spongy type of bone. So you see that we have different types of bone at different subregions of the long bone. We tried to highlight this in our previous lecture on bone. If you've not checked that lecture up, please kindly go and do so. So these are the differences that I've been able to highlight. I'll be looking forward to more in the comment section. So thanks for watching this video, and I hope you find this video useful. Let's continue to stay glued to this channel.